In this video, we demonstrate MRI-guided cervical brachytherapy following the procedure used at Basurto University Hospital in Bilbao, Spain. The case presented is that of a 39-year-old woman with squamous cell carcinoma of the cervix, with a maximum tumour diameter of 6 centimetres and involvement of both parametria, as seen in the MRI at diagnosis. As initial treatment, she receives external radiotherapy in combination with chemotherapy. Response to this treatment is partial. MRI after external radiotherapy showing a 3 centimetre residual tumour. The brachytherapy procedure is carried out under anaesthesia, administered through an epidural catheter. Once the patient has been anaesthetised and placed in a lithotomy position, a urinary catheter is inserted and the surgical field prepared. The surgical material employed is the same as that routinely used for minimally invasive gynecological procedures. Additionally, for this procedure, we use applicators made of paramagnetic materials compatible with MRI for positioning the radioactive source. Of the various types on the market, we have opted for a Vienna applicator, which offers several sizes and curvatures of intrauterine probes, as well as a ring-shaped probe, allowing a good fit to the anatomy of each patient. Moreover, this applicator comes with a device through which plastic needles can be inserted, allowing delivery of additional radiation to the parametria. Once the surgical field has been prepared, we perform a gynecological examination, measuring the uterine depth to choose the length of intrauterine probe. The chosen probe is then inserted. Next, we decide the best sites around the ring to place the needles for the parametrial radiation. Based on the MRI findings, we measure the optimal depth for these needles and mark them to ensure their correct positioning during the procedure. We place the ring probe with the device for inserting the parametrial needles and attach it to the intrauterine probe. Next, we insert the parametrial needles, checking by manual palpation that they are positioned correctly. We place a device to lock and identify the parametrial needles. The obturators are withdrawn from the inserted needles, and the geometry of the implant is checked. Gauze is inserted to displace the anterior rectal wall and thereby reduce the radiation dose to the rectum. Then, the implant is held in place by anchoring it to the perineum. Contrast medium is injected into the bladder. And the patient is transferred to the interventional radiology suite. Planning MRI is performed using a body coil, acquiring T2-weighted paraxial, parasagittal and paracoronal images. Here we can see the sagittal and axial images with a brachytherapy applicator in place. The MRI images are imported into the brachytherapy treatment planner. In the planning images, we identify and delineate the tumour volumes and the neighbouring healthy organs. treatment planner has an applicator library. From this, we select the type used in the patient and align it in 3D in the MRI images in the planner. We also define the paths of the parametrial needles we've placed in the patient. In this 3D reconstruction, we can see the spatial relationship between the tumour and the applicator with the needles inserted. Having defined the tumour and the applicator, the planning software is used to obtain dwell positions and stop times for the radiation source to produce an optimal distribution of the radiation, maximising the dose to the tumour while minimising that received by healthy organs. We check the plan proposed by the software and modify it manually to optimise the distribution of the radiation. Once we have optimised the dose distribution, the resulting plan is transferred to the console controlling the HDR treatment unit. In the treatment room, the source channels are connected to the treatment unit. In turn, these channels are connected to the brachytherapy applicator. Remotely, from outside the treatment room through the console, we activate the treatment unit, and this executes the radiation treatment plan. During the radiation therapy, the patient is monitored by closed-circuit TV. MRI-guided cervical brachytherapy with interstitial needles is an ideal method for achieving excellent results in terms of tumour control, while minimising potential toxicity in patients. And we expect to see this therapy added to the range of treatments offered in most referral hospitals.